I'm Kristen Atkins. I'm an associate professor at the University of Virginia in Charlottesville, Virginia. And I do mainly GYN and breast pathology and cytopathology. And I also oversee the residency program.
And I'm Christina and I'm an associate professor at Stanford. I'm also the director of cytopathology, and I do cytology as well as surgical pathology.
Probably that we're doing a lot more imaging, getting lesions earlier, and what the significance of those smaller precursor lesions are, I think, is something we're going to see an explosion in.
Yeah, and also just diagnosing based on smaller samples and using a lot of molecular techniques and ancillary techniques. And so I think we're moving into an age where fine needle biopsies, core needle biopsies, and obtaining samples for molecular testing is becoming a lot more commonplace.
And I also find that we get consulted more on the significance of some of the things that we diagnose and some of the findings that we see on how that needs to be managed, and having a greater role play in the interdisciplinary conferences, I think, than in the past.
Yeah. And I guess personalized medicine, just doing these studies on the sample so that you can actually direct therapy based on the individual patient instead of large studies where it applies to a general population but not necessarily to that individual.
So this is part of their Patterns series, and what Christina and I did was take breast pathology, which I think is very amenable to a patterns idea, and try to break different lesions down into stromal or ductal or mixed type patterns, and create an algorithm for working out benign and malignant lesions within each of the patterns. We were fortunate to recruit quite a few really good writers and educators to participate in the book, and we're very excited as it's nearing its completion.
Yeah. I think one of the strengths of the books is that we put a lot of emphasis on differential diagnosis and what things you should watch out for when you're looking at a case, so that you don't overdiagnose a benign lesion as malignant or miss a tumor and call it benign.
There are several good textbooks out on breast pathology, but what I think is unique about this one is that it takes it really from a teaching perspective rather than just laundry listing all the lesions that could happen in the breast, to really take it more from the type of pattern that's created, and as Christine said, within the differential diagnosis and how to sort those out. And I think that will be really helpful from a resident's perspective as well as somebody in community practice, as we're seeing more and more breast centers evolve and more breast biopsies being taken. I think it's going to really fill a niche for people when they're seeing something that looks a little bit different, and what else should they be thinking about. They're very patient. Both of us oversee fellowships and residencies and service work, and they've been really good about working with us and our time constraints and helping us with getting the best quality that we can with those constraints.
Yeah, it's been wonderful working with Elsevier. I mean, the editors that we've been working with have been very supportive and helpful in sort of keeping us on a timeline, but also not, just being really pleasant to work with the whole time.